Welcome and thank you all. We're in a very cozy room, and so we expect this to be a very warm conversational session. I'm Andy von Eschenbach. I'm a senior Milken fellow, and it's my pleasure to really welcome you to a discussion of how technology is transforming healthcare. We got a really very exciting panel that will share a very deep perspective on the issues that they're engaged in and how technology is affecting their ability to bring care, state-of-the-art care to people. So we have with us Michael Acton Smith, who is the CEO and co-founder of CALM, that's focused on issues regarding mental health. Ben Marapu, who is formerly a very significant advisor to the National Health Service, but now is the CEO and co-founder of Sarah Care, which is really interested in the distribution of care and moving patients from the hospital into their home care environment. We're really delighted on this side to have Alex Beauvais, who is a partner in the healthcare analytics and the director of that program at McKinsey. Next to him is Sarah Haywood, who is the CEO of MedCity and on the board of Digital Health, and who's really been at the forefront of accelerating and driving healthcare technologies. And at the end, but equally important, is Prashant Mangat, who is currently the CEO and executive director of NMC Health Providers, which is an effort to really become a global provider of healthcare, but have initially focused on the United Arab Emirates for the distribution of care there. So they bring a really broad perspective. For us, the issue is the fact that the Milken Foundation has really focused on being able to enhance global prosperity by the acceleration of the development of capital. And one of the most significant portions of that equation is human capital. And there's no greater way to enhance and develop human capital than by nurturing it through health and health care. So this panel, this discussion is critically important as we even think about the issue of global economies and prosperity, because if we don't address the issue of health, then we in fact will miss the golden opportunities to bring the fruits of progress to people. The 21st century has seen unbelievable transformation and disruptive transformation in even our very notion and concept of health and of healthcare. Science and technology, with our understanding of the mechanisms of diseases and of health at the genetic, molecular, and cellular level, is discovering ways that we can now alter and change those disease processes in ways that, when I was at MD Anderson, were even science fiction. So discovery is exploding, and it's leading to the development of disruptive technologies and disruptive interventions, whether they're new molecular-based drugs or whether there are issues around being able to modify stem cells and alter the body's immune system, and on and on and on. But the challenge has been, how do we get that discovery and that development delivered to patients? So what we want to talk about today is how technology is disrupting that ecosystem and how technology presents challenges but also incredible opportunities for really being able to both enhance human capital, enhance health, and in the process of doing that, create tremendous opportunities for investment and for business development. And so there really is an economic element to this whole idea of creating a better life for patients. So I want to start that conversation beginning with both Sarah and Alex, who have really been at the forefront of driving some of the technology and technology development that's underpinning our ability to deliver healthcare. And then I'll briefly turn to our other panelists and begin this discussion of the transformation of delivery. So if you will, Sarah, tell us in just a few minutes, what do you think are some of the most exciting technology developments that have occurred that you've been engaged in that are really enabling us to be transformational?
My perspective is taken from MedCity and the work that we do also in digital health through DigitalHealth.London. So my focus is on the cluster of the southeast of England with a focus on the Golden Triangle of Cambridge, London and Oxford. And across that area, we've got in excess of 3,600 companies operating in the healthcare and life sciences space. Some of the areas that really, I think, are at the forefront of technology in healthcare and in terms of the transformation of healthcare are in the areas of advanced therapies, cell and gene therapy and regenerative medicine. We've got some really exciting work going on across the whole of the region, which is taking the fundamentals of genetics at the most minute nano levels and manipulating. People will have heard about CRISPR in terms of gene editing, and there's some really fascinating and work going on which is getting real clinical traction in the manipulation of the immune system in terms of treating diseases, particularly cancer. And then at the other end of the spectrum, the things that we're seeing are really now technology starting to make a difference in the way that healthcare is delivered and technology being used as a preventative, a maintenance tool and a therapeutic. And particularly now, increasingly robotics, artificial intelligence and machine learning driving that technology and looking at ways in which that can be applied to release resource and to enable clinical staff to work in a completely different way.
Exciting. Alex, biology has become digital. We now are in the era of explosions with regard to use of the information technologies in healthcare. From your perspective at McKinsey, with regard to technology, how can we enter more effectively into the digital world in the healthcare space?
So I think there's the big picture context, which is about aging population. In 20, 25 years, it's going to be roughly 2 billion people over 65. So from a cost perspective, it's going to be a significant pressure, let alone the question of funding. You have less people working, more people that need care and that are not working. So how do you eventually fund healthcare system? So that's the big picture, I think, of the healthcare industry. Now I think there's two different paths. There is the digital component, and there is how does it become reality. The digital component, I've seen several very interesting things around skin cancer recognition using the camera of your smartphone. How do you analyze picture to make a good diagnostic of skin cancer through machine learning versus physician diagnostic? Sounds a bit scary to a certain extent, but it's pretty accurate. Another one would be around the move from precision medicine to precision prevention. How do you tailor the prevention plans to specific individuals? And the last one I find quite interesting and pretty obvious is how do you help seniors stay at home? The answer is not always nursing home. The answer can be how do you help seniors stay at home? For that, you'll need also digital innovations, for example, sensors, machine learning algorithms, in order to be able to know if a pattern has changed and if an intervention is necessary. So all of those are innovations that on their own have a lot of value, but I think they only have value if they become a reality. And to become a reality, they need to be incorporated in something which is more of a healthcare system type transformation. So if now you load this into the evolution of the healthcare industry that goes more towards value-based care, goes towards accountable care organizations, then those sorts of innovations become a necessity. You cannot run those types of accountable care organizations without thinking about those ways to prevent illnesses. And basically, at the end, it boils down to the best possible healthcare, which is the one where you don't need to go to the doctor. So I think that's the picture that digital needs to help solving if we want to have a chance to face aging population challenges.
Thank you. Ben, that's a great segue for you in the sense that we recognize that care in intensive facilities like hospitals is incredibly expensive. And it's not where patients want to be. They want to be back at home. You have really embarked upon an effort to make that transition from the acute care setting into the private patient setting.
Absolutely, and I think that aligns with some of the themes we've seen already, whereby healthcare is moving from hospital to home, because firstly, it is patient-centric, and we are seeing a more consumer focus, or even retail focus when it comes to healthcare. Secondary, it's also more cost-effective as well. It's cheaper to treat people in their homes, prevent them from having expensive hospital attendances or admissions. Thirdly, we now have technology. And we have technology that fits in our own pockets, which I'm sure every single person in this room almost will have a smartphone or a phone, which they're using to manage so many parts of their lives, but perhaps healthcare is the one that they aren't using it to help manage their lives at present. That's hopefully going to change over the next 5 to 7 years, but again, it's a tremendous enabler for moving healthcare from hospital to home. And finally, we have to ask the question, when we take a step back and look at healthcare, of how do we make it sustainable? It doesn't matter if you're looking across the EMEA region, North America, elsewhere, the increasing cost of healthcare is massively outstripping supply. It's outstripping our ability to pay for it. How do we make it more sustainable? And I think putting patients at the center of their own care so that they can monitor and manage their own conditions in the comfort of their own home using technology is a possible way to address that issue.
Fantastic. Michael, we heard a couple of important themes. One is the issue of preventing problems from occurring. The other issue is use of technology, which will enable a more patient-centric, patient-focused view. And you've looked at this really from a more holistic point of view, that it's not only some of the physical illnesses that need to be addressed, but also mental health and keeping people in a condition in which they're not plagued by the disorders of mental health. How does technology influence your more holistic approach to a person?
Yeah, so hello, everybody. I'm very passionate about mental health. I think, it seems crazy over the last many decades, physical health has been at the forefront, and we think mental health is just as important. And there's an often quoted figure that 1 in 4 people will suffer from mental health issues in their life. We think that is actually wrong. It's 1 in 1. Anyone with a mind, anyone with a brain will have mental health issues, just as anyone with a body has physical health. And it's so important. Mental health is now stepping out of the shadows and into the light. People are talking about it, which is so important. Celebrities, politicians, sports teams. And so, as I say, it's important because some of the major mental health issues have been growing in alarming numbers over the last many years, partially due to the smartphone revolution. But if you look at figures for anxiety, they've been growing. Suicide levels, depression, insomnia, stress, on and on. So we think this is so important to crack, and technology, to come back to the question, is one of the key ways to do this in a preventative measure. So at Calm, we wanted to see, could we create very simple audio content to help people learn to be more mindful and learn to meditate. It sounds a little niche, but 30,000 people download our app every day, 15 million in total around the world. And they are transforming and taking control of their healthcare at home, on their commute, at work, before it becomes a more major issue.
Thank you. Prashant, we've always been faced with the problem of, we have centers of excellence where the care can be highly sophisticated, and then there's difficulty being able to disseminate that more broadly. You've really looked at this issue from a global perspective and how you could disseminate state-of-the-art healthcare globally. How is technology enabling you to be able to do that? And what are some of the opportunities and challenges that you see with regard to dissemination of care based on technology?
Thank you very much. Operating out of a country like UAE, which is having a population of around 9 million, we started 44 years back. Today, we have really grown into multiple countries, in 11 countries, providing not just multi-speciality, but also specialized verticals like fertility and the long-term care, home care solutions. If you really look at it, the evolution actually happened. The main reason behind such evolution actually was the availability factor. The entire region of Gulf, if you look at it, which is the entire Arab region, if you look at it, or 40 to 200 million population, today the biggest challenge is availability. So the biggest concern there, in order to make yourself available, is one of the non-availability of skills and non-availability of data. So if you really look at it, most of the healthcare professionals that are coming into the region are completely coming from other parts of the world. GCC population, which is around 40 million population, doesn't produce more than 50 doctors a year. So it's very difficult for a healthcare company to grow 100% on an imported market. That the same with the nursing, the same with the technicians. So the only way that we can really circumvent that pressure of skills is definitely to bring the technology factor of it. So what we have done is that we have tried to, now we are currently on implementing two major initiatives. One with one of the consumer technology company to implement an unmanned ICU concept. If you look at the entire Gulf, the population is, and the area, there's no connect. Such a huge country like Saudi Arabia, which is the 6th largest country, has got only 30 million population. So scattered, very difficult to make sure that the best ICU care is provided on the remote locations, though the country's per capita GDP is very high compared to many countries in the world. So we are trying to give solutions that will definitely make the technology reaching on those nook and corner, making sure that the telemedicine goes there, making sure that ICU happens there. That makes the healthcare more available on their doorsteps. Same time, the mortality rates comes down drastically. So when it moves to fertility business, we are also trying to do a completely different business model, whereby we are trying to move out from the brick and mortar concept of fertility into more like a e-commerce platform. These type of moving away from one sector's knowledge to the other sector knowledge definitely is the need of the hour of the healthcare industry.
Well, one of the things that strikes me is when I was in government and I would go to our policymakers in the United States and say, we have amazing breakthroughs in technology that are going to dramatically improve our ability to reduce mortality from cancer. And they would look at me and say, well, that's great, except we can't afford it. It's going to cost too much money. So we have this tension between technology on one hand, providing this promise of great opportunities and breakthroughs, but on the other hand, it seems to be costly. So can each of you discuss with us, how do we address this quality cost issue? The imposition of these new technologies, whether they're from the point of view of genomics and our understanding of disease, or from our point of ability to manage data so we can manage populations and get the right care to the right patient for the right reason. How do we view that from, where do you see the greatest opportunities in improving outcomes, and how do we make the case that it's really an investment with profit, not a cost driver? Anyone want to comment on that?
Sure.
Can we start with
I'd be happy to
you,
comment
Alex?
on maybe on one thing. I think there are also different. I was having a discussion yesterday night at dinner with somebody on the VC side that was talking about timing. So team timing and technology for rational for investments. Timing is also a question for healthcare. There are some countries where there are movements happening when it relates to changing the incentives. If the incentives are changing and overall shifting from a fee for service, volume incentive, towards rewarding and paying for high quality at a lower cost, then this is where technology and digital will be even more necessary. Because just assuming that because we change the incentives, then as a consequence of that, quality is going to rise and costs are going to decrease is a bit, I would argue, a bit short-sighted. But this is where digital will come into play. So when it relates to the cost of investments, I think it is a lot more relevant if you are in the context of a country that is doing those sorts of evolution related to new payment models and shifting the rules of the game. Because then the timing becomes very favorable if you think about it from a digital investment. So that's how I think about that. I think the question of timing should be a prime factor when it relates to digital innovation, digital investment, because it's just increasing its necessity.
So if I can jump in,
Yeah,
I would
absolutely.
completely agree with that. I think there's a movement across most health systems from volume to value in terms of how they are reimbursing, and it's about finding technology companies that can effectively partner with a health system and redesign a payment structure that, let's say, works over a 5 or 10 year horizon, as opposed to just a 1 year horizon. That's probably one way of looking at it. I think the other is, the assumption in this question is that technology always costs more. And I think there are still a number of examples within our own sector and other sectors where introduction of technology, in some cases digital, has actually been able to reduce demand or cost within year. And there are definitely examples in the NHS, which we tried to deploy in different parts of the country, where, let's say, an app that supports patients to manage their own mental health in the community or to rehabilitate themselves if they've got COPD is prescribed to them as opposed to them seeing someone face-to-face. That has a within-year immediate cost reduction because of the way it's assimilating into the system. So I think there's an assumption and there's a tension around that assumption. And I think there's also the new way payments are now being formed across health systems, which we need to be thinking more innovatively in partnership with some of these technology companies as well.
So you want to comment on the cost of technology, Ushered?
For me, I think there are three issues. I completely agree with what has been said, is that there's the potential for technology, if well deployed, to strip cost out of the system. We tend to have a approach to health as individuals at the moment where we either consider ourselves to be healthy and well, or we consider ourselves to be sick. And I actually think that we need to, there is a potential new market, which I think we're only really just starting to see the start of, where people become much more informed consumers and start to procure technology in their own right, in the same way as you would go to the pharmacy and you'd buy ibuprofen if you've got backache or whatever. But to be able to start to use technology because they choose to do so to manage their own health, and I think that is a really important driver for the economic model. I think, as Ben has said, there is the opportunity. At the end of the day, the vast majority of health and care is a very human capital heavy and intensive activity. So there is the opportunity for technology to reconfigure the way that care is delivered, and that in turn provides the opportunity to strip cost out. However, I also started my remarks by reflecting on the fact that there are innovations at the very high-tech, deep biology end of the spectrum, which are actually about treating very, very small populations. So clearly the economics of healthcare are based on cost per unit delivery, and digital technology has the ability to do that at very low cost per unit. If you're looking at gene therapy for rare diseases, then the economics are at completely the other end of the spectrum. And I do think that we have to try and find a way of accommodating both, because it's only by having these new technologies which are pushing the boundary of what we know in the boundary of science, do we ever have the opportunity for those things to become mainstream and applicable in much broader patient populations. So I do agree with what Ben has said, is that we need to think of new paradigms for the way in which we support the adoption of technology, but recognising that the drivers are very different for different technology types.
Let's stay with that theme of driving technology to enhance quality, but at the same time being conscious of the cost issues. You have tried to take a very sophisticated technology around infertility management and disseminate that. How do you view being able to introduce that beyond one country to another, making the argument that you're improving quality but not driving up cost?
Yeah. So if you really look at the cost of technology, or the cost that is going to be, sometimes higher than the expected when technology is used, I will see it in a different aspect of it. I see that today, more than looking at the cost of, delivery of the service, maybe this will help us to create a new marketplace. If I'll take this as an example, if you look at it, we are today the second largest fertility provider in the world. But along with us, the top 5 are the 5% fertility treatments happening in the world. So 95% of the entire fertility happens on the tail of, not in the top 5. So if you really look at it, is there a way for us to grow in the mass market? The only way is to do M&A, which I don't think is going to end. We won't be able to reach from a 30,000 cycle today to 100,000 cycle in next 3 years. We will not be able to achieve the triple aim, which is whether the cost, the care, or the health. We won't be able to provide that particular experience for a woman who enter into our clinics. So that's why when we thought about it and tried to completely disrupt the industry of brick and mortar concept, whereby the patient walks into one of those gynecologists where she treats in another country. And then if the doctor, the family doctor or the gynecologist prescribes a fertility treatment, the sperm of the husband or the partner moves from that country to our main center in Barcelona, and we create an embryo and send back to the same gynecologist who later puts across to the uterus of the woman, which really is helping, one, the time to the cost. Otherwise, the women have to travel from their own country to some of the best institutions globally. And today, the marketing is, especially the internet marketing is so confusing for the consumer that they get lost into that particular problem. The emotional issue that a woman is going through in the face of, where she's not getting pregnant, goes away. She's not into a new country. She's not speaking the new language. She's not interacting with a new gynecologist. It's her same gynecologist who takes care of it. So the innovations could be, it could be because of our IT software that helps us. It could be an innovation on the business delivery that we really looked at it. But what really helped us to expand the marketplace, which was only a Spanish business in 2014 December, in the last 3 years, it spread around 11 countries, starting from the entire Europe to South America. So this is the power of innovation. The cost might have definitely gone up, but if you really look at it, the cost of delivery might have gone up, but the cost of particular service, including the time, the flight charges, the hotel accommodation of the entire family, the emotional quotient drain that has happened, all would have saved by this department.
So you really need to look at this in terms of the total cost of care in that model system, not a cost of one element or another.
Exactly.
It's
This is
the
what
total.
exactly happened in the retail industry. From a mom and pop shop, today the cost of a particular material that you would have bought from a mom and pop shop near to your house, today has drastically come down by way of e-commerce, where it really moved away from a mom and pop shop to supermarket, hypermarket to e-commerce. The marketplace became a global marketplace. So definitely as a seller, I definitely have to play the right price for the consumer. So consumer will be the winner of this particular game.
Are consumers becoming more, let's say, informed with regard to their decisions around using technology in mental health?
Yes, yeah, I think it's definitely heading in the right direction. And I think to touch on the cost question as well, I think a lot of this is being driven by the smartphone. I think, it's 10 years old, the iPhone, but it's just getting going, the ways that is going to unleash opportunities and innovation in healthcare. I'd urge anyone to have a look at the health and fitness category in the App Store, the incredible apps that are available at the moment. Everything from Babylon that allows you to have a consultation with a doctor via video, through Active that allows you to improve and manage and track your physical exercise, to LifeSum where you can track your food, so many of these different areas. So smart, informed consumers are already dipping into this. Some of these apps are free or very low cost. So my question would be, how How can governments, how can insurers, healthcare providers gently nudge consumers in this direction so they can take control and do a lot of the lighter touch interventions themselves before we save the face-to-face, the more expensive consultations for the more serious issues. And I think that's going to have a massive impact. And yeah, we're still in the early days.
I'm going to put two things on the table for you that have sort of surfaced in this conversation. The first I'll call connectivity, and the second I'll call sharing. Let me make the connectivity point of view. You know, management of a disease is a process. And in any process engineering, if you can decrease the cycle time, you can improve quality and eliminate costs. So for example, I see a patient with cancer, I institute a treatment, I tell them to come back, and we'll repeat the CAT scan in 3 months. If I could know within 24, 48 hours whether the treatment's working or not, and I can modulate or change that and shorten that cycle time, I'm going to get better outcomes. And I'm also going to reduce waste because I'm not using treatments, waiting 3 months to find out it didn't work. I know sooner. So there needs to be a connectivity between what's going on with the patient and what I know about them. And how does technology enable me as a provider to be able to monitor and keep track of what's happening to my patient on an ongoing real-time basis so I can intervene and make a change and not wait 3-6 months to see what happened with some test that I ordered. That's the connectivity question, which translates into better quality, lower cost. The other thing is, Sarah raised this issue about rare diseases. What we're learning in this revolution in discovery is that there are mechanisms that are common to what we think of as phenotypically very different diseases. And if you understand the mechanism, then the treatment can be applicable in more than one case. Quick example, anti-angiogenesis drugs to reduce the vascularity supplying a tumor turn out to have dramatic positive effects on wet macular degeneration. Two completely different diseases, same mechanism, same drug, you get multiple benefits. But I got to know that. So we've got this mass of experience that's occurring all over the world with being able to apply interventions, but we don't communicate, we don't share the data, we don't share the information. How is technology connecting me, the care provider, to my patient in real time? How is technology going to be able to connect me with the rest of the world so that I can share my data, my information, I can get theirs, and we can accelerate this discovery, development, delivery? I'd like to hear the panel, and then we're going to open it up for some questions and get you engaged as well. But these are critically important issues from the point of view of being able to get the right treatment, right patient, right outcome at lower cost.
Yeah, I'd be happy to speak about connectivity. I think there are two parts of it. There's connectivity from just making the data known, and there's connectivity from having an incentive to have this connectivity happen. From making the data known, there are a couple innovations that are actually quite interesting. We were just talking about mental health. When I look at what Otsuka has been doing on Abilify, and this is the first connected pill, where basically you just take the pill, and then after that there's a signal that's being sent through a sensor, so you know if the person has been ingesting the pill or not. We all know that roughly on chronic diseases you got about 50% of medicines that are not taken. So that question about using technology in order to be able to monitor what drug is taken or not taken certainly is an innovation that does exist, and it's popping up now. So connectivity becomes a lot more possible, even on a case like adherence to drugs. Now the question is, what incentive is being made so that the provider does track that real time? If the incentives is more of an incentive of volume, and I'm a bit back to the question about healthcare systems in the world that might mostly function in a fee-for-service type mode, where there is an incentive of volume versus an incentive of, like reduction of total cost of care. If you have a system that put an incentive at reduction of the total cost of care, then it becomes of a priority of the accountable provider to access some data of that kind so that the people that are following that treatment are indeed following their treatment. So I think it's kind of connectivity from a digital innovation standpoint and connectivity from an incentive put in the system.
Great.
Yeah, I'm particularly excited about the smart home in conjunction with smartphones, and over the next few years, how we can pick up so many different signals from people to determine whether there may be something wrong. So, huge amount of data could be generated from users, everything from, say, a smart sink in the future that analyzes your spit, to a smart toilet that looks at your urine and then passes relevant information to your doctor. And massive amount of information, obviously, across all their different patients. But with machine learning, we could identify when certain signals suggest something may be wrong, and that's when the doctor may say, come in and have a face-to-face consultation. And as you say, the timing between figuring out something wrong or just monitoring will become much, much more condensed and hopefully provide much, much better healthcare.
So I'm definitely in agreement with that. I think there are some fantastic opportunities here. I think the challenge we need to be aware of, though, is essentially this data paradox that exists in healthcare, whereby the people who require the most amount of resource and utilization of the healthcare service are the least likely to use technology. Because the old, the sick, the vulnerable can consume up to 85% of a health insurance or government spend on healthcare services, but they're at the same time least likely to use some of the technologies we've talked about. And so we have to figure out how we can square that off. I think there are a few different ways. One is the IoT movement, which Michael talked about, where you have sensors in a person's home which they may not necessarily need to operate. I think secondly is vicariously, so through other members who are going to be around this person, such as their carer or their family member, who can collect some of this information on a regular basis. And so then it's about empowering these vicarious sources of data. And then I think it's about improving digital literacy of people who are older, who are less likely to use digital technologies, and that's more of an awareness, change management piece, which again, I think we've touched on in different ways. But we need to really crack that paradox in healthcare before we can really unleash some of these benefits of technology and connectivity. Otherwise, we will mainly be focusing on the worried well, who, yes, have smartphones, but account for a very small fragment of utilization of the overall health system.
I want to come back to that in a second, but I want to hear some more on
Yeah, I think, today if you look at the legacy, the fee-for-service system, the insurance companies are not ready to even, the payers are not ready to pay for any of the services that we provide. Today we are all talking about to move from a fee for services to pay for performance, which could be one of the ways in which, we as provider will be able to get reimbursement for such technologies. But again, if you really look at it, what is really actually happening they are trying to remove their risk from the healthcare providers, from the insurance providers. So then it comes to us like providers to think whether we should adopt a technology or not. We may or may not, depending on what is our priority at that point of time. So I think, if you really want the technology to be useful for the patient, of course, you need to have exactly as Ben mentioned, there should be a proper education program that makes the providers and the users, the consumers, as well as the healthcare professionals. But most important is there should be incentivization that should happen from payers to the providers and the patients so that the technology will be adopted in a more faster manner. End of the day, it's the provider. How much of a technology we talk about it, if the provider is not going to put it across, all this technology will be on the shelves of the innovators. So I think incentivization of the patient and the provider at the same time is essential to make sure that this technology comes into really in a useful manner.
Can I say a couple of things in response to what's been said? Moving away from the issue of connectedness, because I think that we're getting there. I would say that we've still got a considerable job to do across all economies to ensure that the underlying data that we're already collecting about patients is clean and is managed effectively and is joined up. So we've got a whole slew of companies that are looking at this connectivity point and monitoring and tracking patients, etc. But we mustn't forget that if we look at the US, it's very difficult to do data analytics on patient data because you get multiple people using the same health insurance number. You have issues in the UK because the data systems were not set up in order to do the things that we want them to do. So we've still got quite a lot of plumbing to do underneath to get all of the systems working. And I don't think that we should neglect that investment and that work for the sake of some of the advances, because if we get that foundation right, there are huge opportunities. But at the same time, I think you raised the point about accessibility of data. And I think it's really, really important that we ensure that we're having an effective dialogue with citizens, with patients, about how their data can be used. Because the reality is that the vast majority are very happy for their data to be used if they think it is for benefit and they understand what that is. But many are quite suspicious about the idea that they might be being exploited. And if we look at opportunities, you talked about the idea that you can track what is happening with a disease state within days of a treatment being given. There are fantastic projects that are generating vast amounts of data that will allow us to do that if we make those data sets available to the people that can come in and can generate the tools and the technology to help us to understand it. I mean, the 100,000 genome project, which is taking place in the UK, is a great example. But we've got to make sure that we address some of the basics around information governance, around people feeling comfortable with their data being used, as well as how can we ensure that data is available to technologists to drill into and find new opportunities in a way that works for everybody.
We got about 13 minutes, and I'm going to open it up for questions now and engage you all in this conversation and dialogue. We've put a lot of really important and I think provocative things on the table. So let's begin with you, sir. And there's a microphone.
Thank you. Thanks for the insights there. So I guess one question, it feels like we're in deep here, and I'm wondering if there's not a missing link that hasn't been talked about enough. So things like smart toilets, for example. Every day I look at a mirror and I know that I should lose about 6 kilos. So I think that there's feedback things that are there at the moment, and we know in most of our countries there's obesity epidemics, and there's a lot of people that still smoke. So even though everyone knows that that's not good for you, so I guess I'm intrigued by the possibility of a lot of this technology, but I'm also aware that there's feedback mechanisms now that people aren't utilising and that are responsible for arguably some of the biggest costs in the system. How do we bridge that gap? Any thoughts there?
Just maybe one idea. I was having a discussion with someone yesterday, and there was bringing an idea which I think is interesting. I don't know what I think about it, but it's just like, what do people really care about? They care about knowing if they're going to be sick or when they're going to die. Do we have the data today to be able to predict when somebody's going to be sick and of what and when that somebody is going to die? The data does exist. So to your question of feedback loop, this one might be a total extreme if you think about it. But if you use genomic data, if you use pattern recognition, you have the possibility to predict what is going to be the health pattern of someone. So how do you make that feedback loop to potentially overcome some of the sharing or data sharing barriers is an interesting question, because people will want to share their data. I'm not advocating for that. I'm mentioning a conversation here. If such data is available, if somebody shares such data as a consequence of which the information that such person receives is the likeliness of disease and stuff like that, like people will be very interested about knowing then what do I do now. So that's maybe a radical option, but the data is available.
I think it's a really important point. Sometimes we can overcomplicate problems and overthink them. This is why I think meditation is so important. You know, it's been around for thousands of years. There's a lot of misunderstanding around it. People think it's woo-woo or spiritual or associated with religion. It's actually incredibly simple. There's a huge amount of science now showing how it rewires the brain. And we see it almost as a base level, a foundation in which all the other healthy habits can be built on board. Once you understand how your mind works, once you have a bit more awareness and ability to take control of your mind, I think you can transform other areas, from when you open that fridge knowing not to take something out. The human mind is good at so many things, but we're not good at doing stuff that we know should be good for us. It seems so crazy. And you know, half of Americans will make New Year's resolutions next month in January. Less than 5% will continue them into the next month. So meditation, as I say, I think is a really valuable way of training your mind and increasing your skills. And that's why we think it's so important for kids as well to be taught in schools. And the government just announced in the UK, I think £300 million to be spent training teachers to help this next generation come through with healthier, happier minds.
Yeah, it's a complex issue, and there's no simple panacea to it all. But one of the things I would say is that making data available does influence behavior. We noted that at the FDA with the issue of putting calorie counts on menus in restaurants, and it does make a difference. So it doesn't solve the problem, but it's an incremental step. So making the data available is at least an important part of the solution you're seeking. Yes, sir. Microphone? Oh, you're being recorded.
Thank you. I'm struck by some stuff that Ben and Michael both said, but also what Alex and Sarah said. Are we not getting into an area with almost consumerization of healthcare, where if we give people all the tools to self-analyze and self-medicate, or at least see what's wrong with them, and we charge for that, even if it's a nominal amount, then people like Sarah can get the funding that they need in a joined-up healthcare system that will provide extra funding for the genome advances that we all know are there. And I love the idea that Alex said that all we're bothered about is will we be sick or will we die. I think I'd like to know that. I'm sure everybody else in the room would. But I think this consumerization of healthcare is a really interesting idea, particularly around technology that already exists on smartphones.
Yeah. So is it happening?
Yeah, I mean, I, as far as I'm concerned, that genie is already out of the bottle. You know, as Michael said, if you go onto the App Store now and you put in type 2 diabetes, you'll probably find about 3,000 different apps, which are all purporting to help you either prevent, manage, etc. One of the things that we haven't talked about, although Michael did touch on it really importantly, is the evidence that's underpinning these technologies and some of the claims that they make. And an area of work that we are very focused on in my organisation is around what constitutes the evidence base for digital technology. Because if I'm running a biotech company and I want to take a new product to market, there is a very clear regulatory path in place for me to take that product to market that looks at safety and efficacy, etc. If I want to write an app and put it on the App Store and say, this will cure your diabetes, I can do that, and there is no one there to stop me from doing that. So, in a sense, the regulatory environment is really still playing catch-up in the digital space. And this issue of underpinning evidence and the scientific case for some of these technologies is critical. But I have to say that I personally, I know it's certainly for those of you from the UK, and I'm sure for all of you in your own countries, the debate about healthcare and funding healthcare is something that features on the news every day. And there is this very strong aversion to the idea of moving people in the UK to paying for their own health. But the reality is that You know, we'll go and pay for gym membership, we'll go to Boots and we'll buy, or any other brand of pharmacy, and go and buy over-the-counter medicines, etc. So we make consumer choices every day about our care. But the reality is that as technology and science develops, there's the opportunity for us to do very much more. And I don't think that that should be being delivered by an acute healthcare system. I think it is right that some of us should elect to pay for those things ourselves, and hopefully to therefore manage our own healthcare in a more responsible and informed way if we can.
So, I completely agree with that. I think healthcare is definitely moving to being more personalised, more democratised, more consumer-focused. I think the challenge then that we have to try and reconcile is you've got the personalisation movement, but then you've also got the movement to be more consistent in the care that you deliver. So regardless of whether you go to a hospital here or in north of England, or it doesn't matter which country we're talking about, but all health systems are striving to be more consistent in terms of the care services, health and care services that they deliver, how they monitor them, the outcomes they deliver, reducing health inequalities, reducing regional inequalities. So how do we maintain the balance between ensuring consistency of care whilst at the same time allowing people to have this consumer-focused, personalised approach? I don't think we've figured that out yet, but those are two challenges that are potentially moving in different directions as opposed to converging.
Mm-hmm.
Yeah, just to add another comment. I mean, one of the things I think is important is we don't lose sight of the fact that as this pendulum swinging from a very physician-centric model where we controlled everything and the patient was just a passive recipient, to now the patient becoming a much more active part, doesn't mean disengagement. I mean, there still needs to be the issue of connectivity rather than detachment. And I'll give you a quick example of the dynamic that can play. The technology doesn't even have to be very sophisticated. There's a great example that was done with heart patients after myocardial infarctions. And they just sent them home with a wireless blood pressure cuff and a wireless scale and a laptop. And every day they were supposed to get on the laptop, get on the scale, take their blood pressure, and get wirelessly communicated back, not to the physician, but the physician's assistant who would monitor that. If they didn't, they got a phone call. Why didn't you log in? And if they did and everything was fine, nothing done. If their blood pressure was going up and their weight was up, they got a phone call. And, don't eat those hot dogs at your grandson's soccer game, and take a little bit more of the Lasix and whatever. And they cut the readmission to the emergency room for congestive heart failure in post-myocardial infarctions in half. So it was better quality, and for the provision of total care, it was a significant cost reduction by eliminating readmissions. So the quick points are, one, there was an engagement. It wasn't just the person monitoring and managing their own care, but that dynamic interplay between them and a provider. There was a cost-benefit model that made it worth spending the money for the blood pressure cuff and the laptop, et cetera. And it kept the engagement process. And it wasn't an incredibly sophisticated, costly technology. So there really needs to be that thematic part of engagement as we make this transition to consumer-based care. Yes, question?
And what is the capacity of the consumer individuals to absorb all these advances? I mean that healthcare, technology, banking, pensions, everybody's dumping things on the consumer with very limited capacity to figure out the choices, to understand what it is being imposed into them, Individuals are very easily manipulated, taken advantage of, charged, abused, Mm-hmm. So, I guess that they will need a lot of mental health support, because they are getting absolutely crazy, I would think,
Yeah. So quickly, what's the role of government regulators? You alluded to some of that issue. What's the role of the responsibility of the payer? And if, in our case, in the United States, employers are taking a much more active role in making sure what's happening to their employees is appropriate. But so others are entering into this space. Who else should get in here to really maintain appropriateness? Let's use that term. What's the role of the government?
Yeah, well, I think just this is a good point, and the fact that I'm hugely bullish on technology and giving consumers control, but you're right, anyone can create an app, anyone can put anything out there, and the snake oil salesman can come out. Consumers can go online to Google and type in their symptoms, and if you've ever tried it, most of the things you get back are that you'll die within 2 weeks. Consumers obviously need professional guidance. So it's a very careful balance. There does need to be more regulatory impact, as there has been for decades with pills and everything else. So no simple answer. I think someone else can probably take the government question better than I can.
I'm going to give you the last word, Sarah. We're out of time.
It's a pluralistic approach. There's not one magic bullet for this. But clearly, my opinion is that things in healthcare need to be well regulated for the benefit of the end user and for all of us as patients. And that's why I think particularly this issue of the evidential underpinning for technology is absolutely critical, and there's an imperative for us to get it right and get it right quickly, so that we all have confidence that the things that we are using are actually going to be beneficial rather than damaging to us.
Couldn't end any better. You've been a great audience. I promised you a great panel, and I think I delivered on that. They were phenomenal. So please join me in thanking them.